Hello, my name is Giulia Horan. I will be presenting on meningitis. This is my paper. Meningitis is an inflammation of the meninges. Just like the name suggests, the ending itis means inflammation. The meninges are protective membranes covering the brain and the spinal cord. Meningitis can be life-threatening if not treated promptly. Um, Particularly when caused by bacterial infections. There are other forms of meningitis that aren't just caused by bacterial. It can also be caused by viruses, fungi, or parasites, but bacteria is the most lethal. Well, not always. I'll get into it. Common bacterial pathogens that cause bacterial meningitis include this one, Neisseria meningitis, Streptococcus pneumoniae, and Haemophilus influenzae. The bacteria enter the bloodstream and cross the blood-brain barrier, where they reach the meninges, which are the protective membranes surrounding the brain and the spinal cord. Inflammations of these tissues is triggered as the immune system responds to the infection. Viral meningitis is typically less severe than bacterial meningitis. Um, it's often caused by viruses like enteroviruses, mumps, herpes virus, and HIV. After entering the body through entry points like mucous membranes, the virus multiplies and spreads through the bloodstream or nervous system to the meninges. Like bacterial meningitis, it affects the meninges and can also affect other parts of the nervous system. Fungal meningitis is often caused by Cryptococcus neoformans or Candida species. Fungi are usually inhaled through spores and spread through the bloodstream to the brain. This form is less common, with infection primarily affecting immunocompromised individuals. Protist or parasitic meningitis includes um, Naegleria fowleri, which is a free-living amoeba that causes a rare form of meningitis. The amoeba enters through the nasal cavity and travels to the brain and causes rapid and often fatal brain infection, targeting brain tissues like the meninges and the cerebral cortex. The pathophysiology of meningitis involves the meninges, which consist of three layers. The dura mater, which is the tough outermost layer, the arachnoid matter is the web-like middle layer, and the delicate inner layer is the pia mater, which adheres to the surface of the brain and spinal cord. When pathogens enter the body, they may cross the blood-brain barrier, causing inflammation in these layers. In response, the body's immune system sends white blood cells to the affected area, which can result in swelling. This swelling increases pressure on the brain, leading to the characteristic symptoms of meningitis. Transmission varies in consideration of each form of meningitis. Bacterial meningitis is transmitted through respiratory droplets like coughing or sneezing or direct contact with an infected person's secretions. Viral meningitis, also known as aseptic meningitis, is often spread through contaminated food, water, or respiratory secretions. Fungal meningitis is acquired from the environment, usually through an inhalation of spores. And the rarest form of meningitis, parasitic meningitis, includes the the Naegleria fowleri, which enters the body through the nasal cavity when swimming in warm, fresh water. Prevention for all forms includes good hygiene and avoiding close contact with infected individuals. Prevention for bacterial meningitis includes vaccination. Um, and there are also preventions for viral meningitis through vaccination for certain viruses like mumps or measles. Symptoms regarding bacterial meningitis include severe headache, stiff neck, high fever, nausea, vomiting, photophobia, and confusion. These symptoms typically occur because inflammation of the meninges increases pressure on the brain, affecting nerve functions and contributing to the previously stated symptoms. Without treatment, it can lead to brain damage, hearing loss, or death. Viral meningitis is more mild than bacterial version, with symptoms like fever, headache, and neck stiffness. Most cases of viral meningitis resolve without treatment, with low mortality in healthy individuals. Diagnosis usually consists of a lumbar puncture, which is um, a spinal tap to analyze the CSF, the cerebral spinal fluid. Blood cultures like blood cultures, imaging like CT and MRI, and PCR tests for viral meningitis. Treatment is also dependent on the type of meningitis. Bacterial meningitis requires immediate antibiotic treatment and use of corticosteroids, which will reduce the inflammation. Viral meningitis treatment include mainly supportive care, and antiviral medications may be used for herpes viruses. Antifungal medication like amphotericin B could treat fungal meningitis. The most challenging treatment would be for parasitic meningitis, considering how rare and fatal it is. Regarding side effects, antibiotics and antifungal medications can cause nausea, kidney damage, or allergic reactions, and lumbar puncture carries risk like headaches or infection. Bacterial and viral forms can be cleared, but recurrence is possible, especially in immunocompromised individuals. Demographics show that regarding bacterial meningitis, the individuals that are highest risk include infants, the elderly, and individuals in crowded conditions. For viral meningitis, it is common in children and young adults. Individuals that are immunocompromised or those exposed to contaminated environments are most at risk for fungal and parasitic meningitis. Artificial intelligence is being used to generate tailored treatment plans and expedite diagnosis through accurately reading imaging. Um, and when it says generate tailored treatment plans, like it'll find it, what it is, and how to treat it really fast. So it's really good. I have some pictures here. The symptoms of meningitis, including fever, headache, stiff neck, sensitivity to light, which is photophobia, nausea, vomiting, confusion/altered mental state, usually brought on by the pressure in the brain, because the inflammation causes it to swell. On this one, it just shows you a picture of what the bacterial meningitis looks like. You can see the different areas in the brain, um, which is really nice, like the different layers of the meninges. This is the dura mater, right? Pia mater, yeah, and like how it affects it. And then here's an actual picture of a brain with the layers. Like you can see the meninges and the infection that can happen. And these are my references. Thank you so much.